new mom, your body goes through a lot of trauma in labor, especially when you give birth to a baby of this size. You miss out on the little things in life, the special experiences you took for granted, like urinating freely, when you need to, when you want to, and not when you don't need to. I wasn't enjoying life until my doctor prescribed me Bethanechol. It is a drug that increases urination for urinary retention not caused by an obstruction. This can be prescribed to patients who are postpartum, like me, have just gotten out of surgery, or just have some issues with their bladder muscles. It helps increase the contraction of your bladder muscle so that you can urinate easily and freely. Bethanechol is a cholinergic drug that works by helping the bladder muscle contract more efficiently, thereby improving your ability to urinate. It will not help urination if there is an obstruction because it cannot remove any type of obstruction in the urinary tract. This drug should be taken 2 to 4 times a day. While taking this drug, it's important to monitor your blood pressure and your heart rate. Also monitor your intakes and outputs, or how much you're drinking and how much you're urinating every day. Assess the lung sounds and assess the bowel sounds to make sure that your whole body is working well while taking this drug. Before taking Bethanechol, tell your doctor if you are allergic to Bethanechol or any other drugs. Tell your doctor what prescription and non-prescription medications you are taking, especially Pronestil, Quinagulute, and medications for colds or nasal congestion. Also, inform them of any vitamins that you are taking. Tell your doctor if you have or have ever had asthma, a bladder infection, epilepsy, high blood pressure, heart disease, Parkinson's disease, an overactive thyroid gland, or ulcers. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding.
Side effects include upset stomach, nausea, vomiting, dizziness, sweating or flushing, diarrhea, headache, increased gastric motility, lightheadedness, abdominal cramps. Serious side effects include fainting, tachycardia, severe abdominal pain. You should call your doctor immediately if you experience any fainting, shortness of breath, a heart rate of less than 50 beats per minute.
This drug should be taken either 1 hour before meals or 2 hours after. You'll most likely be taking multiple doses a day, but that depends on the prescription written by your doctor. You'll know Bethanechol is working when you have an easier ability to urinate without any pain, stress, or major straining. Oh, it's been 30 minutes since I've taken my Bethanechol. I kind of have the urge to urinate. Wow, that's the easiest I've ever urinated. As a fellow mom, I'd like to tell you a few things about Bethanechol before you start taking this drug. It's important to rise and change positions slowly while getting out of bed. Make sure you dangle your feet to prevent orthostatic hypotension. This drug may make you drowsy. Do not drive or operate machinery until you know how this drug affects you. Take this medication exactly as prescribed and do not stop it abruptly without consulting your doctor. Take each dose with a full glass of water. Take a missed dose as soon as you remember it, unless it's almost time for your next dose. Then just skip on to the next dose. I hope your life improves with the use of this amazing drug.